Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Lasia Gore, a pediatric cardiologist at Johns Hopkins. They discuss a rare and dangerous syndrome being seen in some children with COVID-19 that can result in multi-organ failure. They talk about how worried parents should be about this syndrome. This episode was recorded on May 22nd. Let's listen.
Thanks so much for joining me.
Thanks for inviting me. I'm looking forward to our discussion.
So up until recently, it looked like COVID-19 was sparing children completely. And now doctors are seeing this multi-system inflammatory syndrome in some children. First, I'd like to know, how do we know that it's linked to COVID-19?
So, yes, I think you're asking the right questions. Unfortunately, the one silver lining we thought we had, which was that kids were somehow spared, at least physically, from COVID-19, has now been completely turned on its head. One thing, while the vast majority of kids with this virus do very well, we're just learning now that there's a small subset that gets very sick. And as our listeners have probably seen in the news and on social media, there is a newly described syndrome in children that we believe is related to COVID. It's called the Pediatric Inflammatory Multisystem Syndrome. Some people abbreviate that as PIMS. But the CDC recently renamed that to the Multisystem Inflammatory Syndrome in Children, MISC. And I guess this is new enough that we don't even, as a medical community, have a name for it. But I'd love to provide some background on this. I think as people have seen, on April 26th of this year, doctors in the United Kingdom reported this mysterious illness that is affecting previously healthy children. And then in late April to early May, we started seeing emerging reports from New York reporting a similar illness in children. And that was seen almost exactly 1 month after their peak COVID-19 infection in the state. So they've reported up to 150 cases so far since the first few cases were reported in late April and counting. Overall, in the United States, at least 19 states have reported this illness. And in our own mid-Atlantic area, we've had 4 cases in Maryland. We've had about, Washington, D.C. has had about 23 cases. And I suspect we're going to continue to see a little bit of an uptick. I think you asked about how we know it's related to COVID. And one of the things we've seen in all of the studies, the rapidly emerging studies, is that we have 2 ways to know if this is related to COVID. We have 2 ways of testing. One is to test directly for COVID viral particles, and that's the nose swab test that people have heard about. And the other is a blood test. And the purpose of the blood test is to look for specific antibodies that tell us that the child has had COVID infection sometime in the preceding few weeks before they came to us sick with the suspected syndrome. And based on the studies that are emerging from Europe and New York, these are areas that obviously hit their COVID peak before us here in the Mid-Atlantic. Most kids have evidence of these antibodies to COVID, even if they have a negative nose swab when they come in with this illness. So the thought is that once these children get sort of either asymptomatic or a very mild COVID infection, their bodies have this immune response that just goes into overdrive and triggers this cascade of events that then attacks their own organs, and it has them presenting in this multisystem organ failure, or MISC syndrome, that we're now noticing in kids.
So once these kids get sick, is it just happen really quickly? And what kind of symptoms do they have?
Yeah, so great questions. These kids do get sick rather quickly, is what we've seen so far from what we know. But there are some patterns, and I'd really like to highlight those. The most common presenting symptoms are high fever, and in children, gastrointestinal complaints. And one study has reported up to 80% of children have sort of a persistently high fever and gastrointestinal issues such as abdominal pain, vomiting, or diarrhea. Some people have actually thought this represents an illness similar to acute appendicitis, but it ends up being this COVID-related syndrome or MIS-C. Other symptoms that people look for or should look for are just significant lack of energy, significant weakness, loss of appetite, or kids just don't act like themselves. We've seen associations with rash, conjunctivitis, or bloodshot eyes in children, and the whole syndrome is actually a sort of a constellation of all of these presenting signs and symptoms, with fever and abdominal pain being the most prevalent and concerning.
I think that most parents were feeling confident, right, that COVID-19 was not going to be deadly to their children. So how worried should we be? I know it's relatively rare at this point. Should we be worried? What should we watch for if our children may have been exposed to COVID?
Yeah, so I think as a parent and as a pediatrician and pediatric cardiologist, if there's one thing I know, it's impossible to tell parents not to worry. And my message to parents and myself included is to remember that this is very rare. So even in areas that have had large numbers of COVID infections, we're seeing still small numbers of these kids with this illness. We still don't know enough to know what the risk factors are. There are some emerging signs, but we don't know enough to know which kids are going to be affected. What I will emphasize is if you see signs and symptoms such as fever and GI illness and or gastrointestinal illness and rash and other things, it's important to get your kids to medical care. What we have noticed is that while these kids present sick and sometimes and very often require ICU admission, what is really important for everyone to remember is that most of these kids have actually done quite well. And we are working on shortening everybody's length of stay in the hospital, but most importantly, some of these kids who require a lot of multi-system support. We've heard this association with Kawasaki-like syndrome, and we can get into that a little bit more. But we are applying some of the treatments that we've used in other illnesses. So illnesses where the heart muscle is affected, such as myocarditis, and illnesses such as Kawasaki disease, which are, again, presumed to be in a response of overdrive immune systems. So the most common things we do are these kids, if they're sick enough to be in the ICU, they're supported in terms of all of their organ function, including their heart function. They receive medications that we think will tamp down this immune response. One of the most common ones is an IV medication called IVIG. There are other medications that we use, which we have a lot of experience with in other syndromes. And more recently, actually a study that came out just 2 days ago, showing that even in a small set of children in France with this syndrome, very good response to some of these therapies. So that's where we're getting started as we continue to study and learn more about this from our colleagues around the country and around the world.
It's remarkable. This disease has only been around, that we've known about really, for 6 months or so. And then we keep hearing about new symptoms, new consequences. I guess we're going to continue to still learn more as we move forward.
I think that's absolutely right. We're only just about getting on board, maybe, with the respiratory illness associated with COVID-19. And so as the pediatric community, we're learning about a brand new disease that I think is probably here to stay. And what has been really sort of gratifying about this is the immense amount of medical literature and knowledge sharing that's happening both formally in our journal articles and publications, but also informally within our own community, information that's being shared very quickly and efficiently to be able to address these issues as they emerge in different parts of the country.
Have you seen any of these patients?
So yes, we've had our first few cases in the last few weeks at Johns Hopkins. And while obviously we all know that this is new now and expect to see more of this in our Mid-Atlantic area just based on timelines in Europe and New York, we feel quite prepared. We typically will assemble a large multidisciplinary team of physicians, as is true for most tertiary care centers, of infectious disease doctors, rheumatologists, critical care doctors, obviously pediatric cardiologists, and other providers to be able to, so all kids are getting many, many heads thinking about them and applying all of the various subspecialties and medications, and also tapping into the broader communities and all of these different subspecialties to be able to really provide the best possible care and the most cutting edge care that we can.
You mentioned Kawasaki disease.
Yeah.
How does it relate to this COVID syndrome? And can you apply lessons that you've learned from Kawasaki disease into treating this new syndrome?
Right. So, initially when you saw reports in the news media and in the literature, this was described as a Kawasaki-like disease. And I think it's because a lot of the clinical manifestations are similar to what we have seen for about 4 decades in Kawasaki disease. So Kawasaki disease was first described in the 1970s. It's a clinical syndrome that we actually don't know the cause for, but have seen pretty commonly in kids. Typically, it's very defined, has been vastly studied, and includes 5 days of fever, a specific kind of rash, bloodshot eyes or conjunctivitis, swelling of the hands and feet, etc. So there are some lab criteria that are applicable in Kawasaki's. And so separating the two diagnoses can be a little tricky, and a lot of the symptoms that I've described, as you are now putting together, are very similar to Kawasaki disease. We have seen some emerging trends, though, that make this different. And one of them, of course, is what I mentioned earlier, was the incidence of, or the indication that these children have COVID based on either their antibodies or their viral PCRs. The other thing we've noticed is that Kawasaki disease typically affects younger kids younger than 5 years of age. This MISC seems to affect slightly older children, usually in the 8 to 10 years, ranging between 6 to 15 years of age. So a little bit older age group in MISC. And what we have noticed, unfortunately, is also that there's higher levels of heart dysfunction, heart muscle dysfunction in MISC compared to Kawasaki disease. However, a lot of the treatments that we've applied are similar, and treatments that we're very comfortable with from Kawasaki treatment, and we found that there is good effect. So we're continuing to study this disease in its separate form, but encouraged by what we know about some of the other similar vasculitis or inflammatory type diseases.
When you talk about inflammation of the heart, like, that sounds really scary. Is that something that people can recover from?
Yes, so inflammation of the heart can happen for many reasons, and it's given this broad name called carditis. And we've seen this as pediatric cardiologists. We do live and work in a world where we see inflammation of the heart fairly commonly. And just to back up for a second and describe what happens, the primary function, as most people know, of the heart is to pump blood to the entire body. So an inflammation in the heart muscle can critically alter its pumping function and delivery of oxygen to the body. It can also affect heart valves, and very importantly, the very tiny but vitally important blood vessels called coronary arteries that supply blood to the heart muscle. So when the inflammation affects the heart muscle or coronary arteries, as you can imagine, the heart does not pump blood effectively to the body and deprives our organs of oxygen, which is critical and leads to some organ failure. Since we've treated this before, we are treating this the same. We have blood tests, such as troponin levels and other biomarkers that we can test to assess how the heart is functioning. Most importantly, as cardiologists, we rely on something called an echocardiogram, or an ultrasound of the heart, to quantify how the heart is functioning. And for children who have any kind of heart dysfunction or evidence of inflammation or fluid around the heart or any of those things, they are supported in the ICU with medications that protect their heart, monitor for any heart rhythm abnormalities, and really proactively try to treat and prevent any additional damage. So while it is scary, we have experience with that, and we're at this point applying the same therapies that we have, and we've had good success with it as a community and here at Hopkins.
Well, this sounds like something we're really going to need to watch. And thank you so much for sharing your insight. Lassia Gore, I really appreciate your time.
Thanks so much for having me.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.